I'm now going to demonstrate giving an IV push medication through a running IV, and the IV is compatible with the medication. The order that I have is Lasix 20 milligrams IV push stat. So I look up Lasix and find out the side effects, the actions, and all the things you normally find out about medication. And then also, because it's IV push, I need to know two things. Does it need to be diluted? And it doesn't. And how fast can I give it? And when I look up Lasix IV, it says I can give it over 1 to 2 minutes. And it's the lower side of the dosage, so I'm going to give the 20 milligrams over 1 minute. So I go to my medication, my MAR or order, and then to my medication and pick out my Lasix. And Lasix comes, this is a single dose vial, and it's 20 milligrams per 2 milliliters. So I'm going to give the complete vial of this. So I do my first check. And because this, I'm going to open this vial up to show you the top of it. Because this is not accessed with a blunt cannula, I need a needle to withdraw that fluid. So I'm going to get a syringe, 3 cc syringe, and place a needle on the end of that so that I can withdraw the medication. And I'm also going to draw up some saline flush. Now, because the running IV is compatible with the medication, technically I don't need a pre-flush or a post-flush. But because I'm giving it right here at this injection port, which is closest to the running IV, to the site, actual site, I like to just post-flush, just to make sure that you're present while the complete medication is in there. Because when you give that Lasix, it's basically going to be sitting in that tube. So you can use a post-flush, or you can also let the IV flush that. So I'm going to draw up a post-flush of 2 milliliters, because that's what we use in the lab for our flushes. Usually it's, like I said before, 3 milliliters, depending on where you're doing your clinical. But we like to conserve in the lab. So here's my 2 milliliters of saline, and I've marked it, so I know what I got in that syringe. Really important when you start doing IV push medication, because which is the saline, which is the Lasix, that can get confusing. So I got my saline, and now I'm going to draw up my Lasix. Take another alcohol swab, and I'm going to clean the top of that. And I have a needle. And I'm going to just draw out basically the whole vial, because it's 20 milligrams in this vial. It should be 2 milliliters, and it is. Give it some of that air. I'm going to recap that with one hand, because it's a needle. And then when I go to actually inject this Lasix, this is a blunt cannula port. It's a needleless system. So depending on the type of needleless system you have, you either need a blunt cannula or you just need a top. So I am going to remove that needle and place on there a blunt cannula. Okay. And then I'm going to mark that Lasix. So now I have my Lasix, IV push medication, and then my normal saline post-flush. What's running in the IV, I don't know if I said this yet, is normal saline. So if it was something different, you might have to check compatibility, but we know that medications are compatible with normal saline. So I'm doing this in the med room, and then I'm going to get ready to go into the patient's room. I've got my drug, my flush. I'm going to need some gloves. And an alcohol swab, and make sure that I've got my watch. Come into the room, and I've done 2 checks already on my Lasix, so I'm going to do my 3rd check when I come in. Wash my hands, identify the patient with 2 identifiers, explain to the patient what I'm going to be giving him or her, and what kind of effect they might feel. For example, if you're giving IV push Lasix and they don't have a catheter, then you might want to explain to them that they're going to need to urinate within the next half an hour or so. So that's important to do. I'm going to place on my clean gloves because I'm right here at the site. So if I'm giving them medication, the patient pulls away, it could be exposed to blood if the IV came out. So I've got clean gloves, got my Lasix, and I've got my flush. I assess the site and I see that it's running well. There's no sign of infiltration or phlebitis. There's no redness at the site. Now, because I'm going to give it at this port, what I want to do is crimp off the IV tubing above it to make sure it's probably not going to backflow, but to make sure that you're just injecting into this area, I'm going to crimp that off. And the way I like to do it is make a circle, so then you can hold the whole tubing in one hand and you have the other hand free to give the medication. And then I've got my watch ready to go. And like I said, we're going to give this over 1 minute. So we have 2 milliliters, so within 30 seconds you should have about 1 milliliter in. Within 15 seconds you should have about 1/4 of a milliliter in. So you can kind of estimate it that way. If you've gone 1/4 of a milliliter and it's gone in quicker than the amount of time, just wait the rest of that time before you inject a little bit more. Clean off the port. Got my Lasix. And the first 15 seconds, I'm going to inject approximately 1/4 of the medication. And another 1/4. And while you're doing this, you're assessing the site and making sure that it's not infiltrated. A minute can seem like a long time. Okay, and then this would go directly into sharps. And now I want to flush it with my saline. Again, like I said, you could open this up and let the IV flush it. But I want to be present while this continues to go in. So I'm going to initially inject this at a slow rate because you're continuing to give the Lasix. It's still in that tubing. As you can see, actually, you can see because the Lasix was discolored. You can still see it in the tubing. I gave that about the same rate. And now, it looks like it's pretty flushed out. I'm just going to slowly administer the rest of my saline. And then that would go into sharps. And then I'm just going to make sure the IV is regulated at the rate that it's supposed to be. And that's it for giving an IV push medication via a running IV site.